Hi everyone, I'm Prasil Guragai. I have completed my Diploma of Nursing as an enrolled nurse student from CIT Canberra. I'll now be answering a series of questions related to my practice as an enrolled nurse student at Canberra Health Services. Question number one, scope of practice. As an enrolled nurse student, I recognize something is outside my scope of practice when I'm not trained, not competent, authorized, or not confident to perform any tasks safely. I'll always work within my NMBA enrolled nurse standards, ACT health policies, and WHS requirements. If I'm unsure or patient condition changes, I prioritize patient safety. I do not proceed independently. Instead, I communicate promptly with my supervising registered nurse. I also seek guidance and only perform tasks within my level of competence. This ensures safe, accountable, and person-centered care. Moving towards the next question, question number two, regarding medication safety and errors. I ensure safe medication practice by following ACT health medication policies, NMBA standards, and the NSQHS standards. I apply the 10 rights of medication administration, which are right medication, right dose, right route, right reason response, right person, right allergies, right to refuse, right time, right expiration, right form, and right documentation. I also ensure correct verification, double checking, checking allergies, accurate documentation, infection prevention and control practices, and I always work under supervision of my RN. If a medication error occurs, I immediately prioritize patient safety. I assess for any adverse effects such as changes in vital signs, level of consciousness, pain, respiratory distress, or any allergic reaction. I promptly inform my supervising RN, closely monitor the patient, and follow the instruction. Then I complete incident report form as per ACT health policy, document accurately, do a riskman report, and reflect on the incident to prevent recurrence in line with NMBA and NSQHS standards. Question number three, regarding managing workload. As an EN student at Canberra Health Services, I manage my workload by prioritizing care using NMBA standards, ACT health policies, and the DRABCDE approach, focusing on patient safety and clinical deterioration. My first priority would be patient B, who is experiencing chest pain and appears pale and diaphoretic. This may indicate a possible acute coronary syndrome or heart attack, which is life threatening and requires immediate escalation. I would urgently assess using DRABCDE, monitor vital signs, and escalate to my supervising RN without any delay. My second priority is patient C, who is experiencing nausea. While nausea may not always be immediately life threatening, it can indicate underlying complications such as infection, medication side effects, or deterioration depending on the clinical context. I would assess severity, check observations if indicated, provide comfort measures within my scope of practice, and report it to RN for further management. Next patient would be patient A, who requires full nursing assistance to void. I'll attend to ensure comfort, dignity, and safety, or seek assistance from the team if required. Finally, patient D is scheduled for non-urgent CT scan and requires transport escort. I'll coordinate or assist once higher acuity needs are managed or delegate appropriately if available. Throughout, I will continuously reassess all patients and maintain clear communication within my supervising RN, following my NMBA standards. Going to question 4, NSQHS and WHS practice in my daily practice at Canberra Health Services. I incorporate NSQHS standard by ensuring high, safe, quality, and person-centered care. This includes recognizing deterioration, early follow infection, prevention and control procedures, maintaining medication safety, and ensuring clear communication within the healthcare team. I also follow WHS principles by maintaining a safe work environment for patient, staff, and myself. This includes safe manual handling, correct use of PPE like donning and doffing, reporting hazard, and escalating risks promptly. Overall, my practice is guided by safety, accountability, and my EN scope of practice under ACT health policies. The last question number 5, says communication and CHS valued during my clinical placement at Canberra Health Services. I cared for a patient who was anxious before a procedure. I used calm, respectful communication by introducing myself, explaining the procedure in simple terms, and checking understanding. I actively listened to their concerns and provided reassurance within my EN scope, which helped reduce their anxiety. I then escalated their concerns to my supervising RN for further support care care planning. This demonstrated effective communication and teamwork while upholding NMBA enrolled nurse standards. In doing so, I reflected CHS values by showing respect, compassion, integrity, and collaboration while maintaining patient centered care. Thank you very much.